So the H.E.L.P model was originally developed by Bradley and Summers. Traditionally in like the medical field, when individuals with disabilities have, quote unquote behaviors, they've been looked at as like a psychiatric disorder, and that's how traditionally medicine has been treating them. So, wanting to administer things like antipsychotics and things for those type of behaviors. Whereas we know that, for any individual, behavior is a form of communication, and for people with disabilities, that communication could and is likely representing a need that is unmet or unrecognized. So the H.E.L.P model stands for, the H is health, the E is environmental factors, the L is lived experience, and then the P is psychiatric diagnosis. It's important not to just continually jump to there and try and treat the symptoms of something that could be something completely different. If we don't go through that H.E.L.P model, we end up missing things that
need to be caught.
Yeah.
Like imagine if I was nonverbal, not able to communicate, and I had like really bad dental pain. So every time people put food in front of me, I'm like, I don't want to eat that, my teeth hurt. So I knock the food away, or I hit my face like this because I'm experiencing so much pain. And then people are like, oh my gosh, this person is just having all these behaviors, and what can we do to fix it? And then they're throwing all these different medications at me, and then these medications are making me feel sick. And then this dental pain goes completely missed because we're not looking at the foundations of what could be happening. So that's something that we really rely on for supports, to be able to kind of communicate that to us so that we can be the ones to be like, okay, what assessments do we need? What healthcare professionals do we need involved in this, and what can we do to help that person through whatever they're experiencing. So it's not even just like communication with us, it's communication with the teams, and then also the people supported. So when people are having these quote unquote behaviors that are seen as problematic, that's their way of trying to tell us that something's wrong. And if we're just saying, oh, this is typical, and giving them medication, we're just doing a huge disservice to that person, because that's not fair. We're basically ignoring what they're trying to communicate with us, which is awful.
It's really incredible here at CORE that we are able to do that role, because if you think about like the traditional healthcare system, an individual that we support might go see their family doctor, and what is an appointment, like 15 minutes? It's just not realistic to happen within like a 15-minute family doctor appointment. So I feel like really fortunate that here at CORE we're able to kind of do that behind the scenes, I guess, and then go with that information so that we can collaborate and kind of do it before that brief appointment that we get.